Hello again. My name is Amy Jackson. I am a second year student here at the University of Arkansas for Medical Sciences, studying rural and global health. My presentation topic is economic instability and discrimination, which are two major topics to cover. In this presentation, I plan to cover the who, what, when, why, when, and how surrounding the correlation between economic instability and discrimination. Before we start, for those who are unaware of what correlation is simply stating that two factors may influence each other, but there is no definitive proof of such causation. Causation implies that there is definitive proof of two factors being linked together. So on the next slide, we will talk about and give a quick recap of what we already talked about in part one, which was very detail heavy. Next, we'll go to the next slide. So on this slide, I wanted to give us a quick recap of what we covered in part one. In part one, we talked about multiple things, but the most important topics were how economic instability often affects socioeconomic status. Economic instability can influence psychosocial outcomes, behavioral outcomes, psychosocial exposures, behavioral exposures, and how economic instability can also get under the skin and into our brain. So we know that socioeconomic status can affect one's quality of life and health. We know that suicide, mental health issues, inflammation, psychological distress, depression, anxiety are all factors influenced by financial instability. Epigenetics, the hypothalamus pituitary adrenal axis, and neuromodifications can also be influenced by financial instability as well. Now we will move on to the next slide. On this slide, we'll talk about how changing discrimination through non-health policies and practices can affect minority populations. Changing the radius of toxic environmental waste sites from low-income neighborhoods will reduce discrimination and affect population health. Acknowledging environmental racism can reduce discrimination and affect population health. One way to ensure population health is to address food insecurity and ensure that everyone is food secure. Since there are several ways to change social stratification's effect on discrimination through non-health policies, we should define what discrimination, non-health policy, and health practices are first. According to Merriam-Webster Dictionary, characterizing discrimination is the act of making a difference between different races, sex, or ethnicity. Non-health policies are structural, socioeconomic, behavioral, and biological determinants that work together simultaneously. And that comes from the World Health Organization. And non-health practices can be simply food insecurity, environmental racism, and racial equity in housing. According to Taylor 2022, 1 in 6 in America lives within 3 miles of a toxic waste site. There are several Superfund sites maintained by the EPA. If you would like to know more about these sites, please feel free to go to the EPA website. In Arkansas, we have 10 Superfund sites in total. One is in Omaha, which is Boone County, one in Newport, which is Jackson County, one in West Helena, which is Phillips County, one in Walnut Ridge, which is Lawrence County, one in Edmondson, which is Crittenden County, one in Fort Smith, which is Sebastian County, one in Jacksonville, Lone Oak County, one in Norfolk, Union County, one in Mena, which is Polk County, and one in Paragould, which is Greene County. According to Taylor, additionally, people of color are more likely to live near these environmental waste sites or dump sites. Therefore, the Environmental Protection Agency should force housing developments to avoid building within a 5-mile radius of a toxic waste site. As a result, people of color may have an advantage regarding their health. Research shows that the closer that these individuals are to these waste sites, the more adverse health effects they are liable to experience. Toxic waste sites also can leach out dangerous chemicals into the groundwater, drinking water, soil, and air. People of color and other minorities can develop long term mental and physical health issues from these exposures. Environmental racism is a form of racism which burdens communities of colors and other minorities with health hazards through policies and practices. Experiencing environmental racism in the personal or workplace settings is very prevalent. For example, the area between Baton Rouge, Louisiana and New Orleans, Louisiana is called Cancer Alley due to industrialization within that area, increasing the residents of these towns' likelihood of developing cancer. There's Baton Rouge and New Orleans are not that far apart from each other, and these industrialization is not able to take out some of these toxins that they're putting in the air. These residents, they may not be able to fight against these industries that choose to come there to build. Therefore, global environmental policies must become stricter to make effective changes. Food insecurity is also quite common within the US, especially among people of color. When someone is food insecure, they may experience several adverse health effects such as cardiovascular diseases, death, and obesity, according to Precker. According to Directory, during COVID-19, many food insecure individuals were more likely to feel discriminated and uncomfortable in their own neighborhoods. By alleviating what we call food deserts, and creating community gardens would be the best way to address these food insecurity. Often food deserts, such as the area outside of Seattle, Washington, and Oregon, prevent people from accessing healthy foods that are essential to life. With financial assistance from cities or states or even the federal government, maybe nutritional companies can move into these food deserts and alleviate the need for food. Community gardens could also provide fresh fruits and vegetables for all of those who are in need. These are just some of the suggestions, but there may also be some more that could also be used to help alleviate food insecurity. This slide talks about how changing discrimination through non-health policy practices can affect minority populations. Handling population health through immigration policies, unaffordable housing, and the reality of marriage perpetrates discrimination. There's much more that could be considered as well, but these are the ones that we will talk about today. Immigration policies keep immigrants condemned. Here in Arkansas, we have a lot of immigrants from different places. For example, the Marshallese people in Arkansas that live in northwest Arkansas migrated here from the Marshall Islands. These people are eligible to work, but they're not eligible for health insurance, so they have to become United States citizens, which I think is incredibly unfair.
These policies should be changed so immigrants are allowed at least some basic health insurance coverage, whether it's all their kids, Medicaid, or Medicare. Simultaneously, people of color and other minorities do not live in affordable housing, according to five policy solutions to advance racial equity in housing. Solutions to creating racial equity in the housing market are increasing people of color's ownership, giving incentives to invest in rundown areas, and stopping the practice of redlining. Many people of color do not own their homes, they rent their homes, and giving that ownership would give them some type of equity. Also, by the cities and states or federal government giving investments to build up rundown parts of town, we can see more economic growth and stopping the practice of redlining would help advance the community by stopping the discriminatory practice in which services are withheld from people who reside in neighborhoods which are classified as hazardous to them. In the earlier years, wealthier neighborhoods were off limit to racial and ethnic minorities and low income residents due to the fact that they believed that these neighborhoods' property would go down. Also, the financial issues of a marriage keeps one discriminated against socially due to them not having money. As you can hear, many relationships go through financial issues, and those finances can hinder people of color and other minorities from receiving a better life quality. So, three policy recommendations to change economic instability and discrimination among minority populations are to create a fair playing field for everyone. By creating a fair playing field for everyone, we will be able to see highly exponential growth for everyone within economic and within social parameters. By making the Environment Protection Agency stricter when it comes to socially disadvantaged health will save people from being put at advantage by these Superfund sites. And by increasing the uses of the Employee Equal Opportunity Program within the workplace creates opportunities for everyone to advance the world. We practice recommendations to change economic instability and discrimination among minority populations are to enlist the help of major figures such as the President of the United States, Joe Biden, to help instill these practices through executive orders or through bills. Second one is to recognize that as a physician or as a social worker, whatever capacity someone is working in within practice, that their patients or clients may be socially or financially disadvantaged from birth. So therefore they may never be able to get onto a economically stable path, but we can try to set them up for the best path, period. And lastly, have sensitivity training. Over the past couple of years, we've been seeing sensitivity training for Starbucks and Coca-Cola in regards to racial training. We could take some of the training and also manifest it to be sensitivity training in regards to how economic instability can affect discrimination among minority populations. In conclusion, eliminating discrimination is necessary. It is what we must do in order for everyone to live a just life. With many changes, population health can become realistic for everyone, which would be great. And in the future, our top priority should be reducing discrimination, which is this is my works cited page. Please feel free to look at it and enjoy. Thank you for your attention, and if you have any other questions, please feel free to contact me at ejackson3 at umass.edu. Thank you for your time.